Hi, Ime Shu here with My Allergy Advocate. This is the fourth video in my series I've called Celiac Disease and Still Sick. I'm here to talk to you about lifestyle issues around having celiac disease, managing the lifestyle, and any symptoms when you happen to feel sick because of having celiac disease. I'm not here to offer medical advice. If you are here to seek medical advice, I advise you to go and talk to your medical health provider. Ironically, that's exactly what I want to talk to you about today. If you have celiac disease, there are lots and lots of opportunities where you're going to have to be in a clinic or in an emergency room department. I hope not, but it happens because you got gluten and you're not recovering well. Or you're going to have to interact with some other health team member for testing or some kind of follow-up. And chances are you're going to encounter different kinds of healthcare professionals, some of whom completely get and understand your disease. And then you're going to run into other people who leave you feeling like you've made something up, that your needs are made up in your head or extraordinary, and they don't want to take the time to listen. They miss cues that you are trying to give them, or worse, they treat you like the difficult patient. Now, full transparency here, I'm a registered nurse and a licensed mental health counselor in the state of Washington, and I can tell you I have been a part of the case reporting at the end of an evening where we talk about all the patients coming off of a shift, or you're the person coming on and you listen so that you can understand how the patients were doing during the night and you're coming on to the next shift. And when I hear or have heard in the past the words difficult patient, I have to tell you I cringe, because most of the time when I hear either that term or it's being communicated to me as if the patient is being difficult, I feel it's actually not the patient's fault. It's the practitioner having difficulty dealing with the patient, not the patient's fault in having a disease or being in discomfort or being unhappy about something. So most of the time it's on the practitioner to recognize they should not be calling the patient a difficult patient. But I've been in that place where I was treated that way, where I was not believed about my disease state, was told to do things that would not have been in my best interest, that would keep me sick, that would not fix the situation. And nowhere is it more critical that you're listened to than in the emergency department of a hospital when you are in crisis. And I found myself in that situation where I was in crisis and my gut was completely inflamed. In fact, the gluten incident that I had caused particulate from my small intestine to spill out into the abdominal cavity, because as you know, gluten will punch holes right through your small intestine. So there was food particulate in the abdominal cavity. There was major inflammation. I had projectile vomiting, projectile diarrhea. It was not pretty. And I was in a very desperate situation to be cared for. It's very critical that if you sense that people are not listening to you, that you get their attention, that you become an advocate simply by raising your hand and saying, I need everybody to stop what they're doing and just listen. And then you tell them what you need to tell them about your condition. Now, their number one priority is simply to stabilize your condition. That is what an emergency room and their team is tasked to do by law when they provide medical services. They are not there necessarily to treat your disease. They're there to treat your condition, to stabilize you so that you can be discharged and followed up by another medical health care provider, maybe a mental health care provider if it's pretty traumatic, right? So what you want to do is be that advocate. And then if you sense that somebody is treating you like that difficult patient, you might request to work with somebody else. You might need to tell them, I am not making this up. Or you might need to connect with that person and say, I realize you're trying to stabilize my condition. I have these other needs that need to be met at the same time. You may get more collaboration for your health care. Now, is that kind of disappointing and distressing to hear, that when you go into these environments, you have to be that advocate, when it seems more assumed that you should be able to drop in there and they should be able to do their thing and do it correctly? Well, guess what? This is the state of medicine in the 21st century, and it's still a collaboration as much as it can with a conscious patient. You have to advocate for yourself. If you can't, then you need to always have somebody around who can help be that advocate for you when you cannot speak for yourself. In my experience, when I have encountered people who have given me that sense that I'm the difficult client or the difficult patient, I am in a position where I will tell them, I sense that you feel like I'm making this up, and I really wish that I were, but I'm not. So either you listen to me so that I can help you help me, or I would prefer to work with somebody else. That is actually your right as a patient, to ask for another opinion. And if there is another doctor on call in that emergency department, you can get another set of eyes. You can get another advocate who's there on staff to help look at your condition and make certain that your needs are taken care of. And if there's anything that I can do to help encourage you on this point, so that you don't have to keep saying you have celiac disease and you're still sick because the medical community that you engage with keeps you sick by not understanding your disease, hey, send me an email, contact me through my current fun blog, which is myallergyadvocate.wordpress.com, which is coming to a .com very soon at the end of this month in January 2018. Again, my name is Ime Shu, and thank you for listening.